Hey guys, this is Dr. Hub. Today we look at the endometrial carcinoma types. So there are two types, type 1 and type 2. Now let's look at the type 1. So under the type 1, what we need to know is that the age. The type 1 age is nothing but 55 to 65 years of age. And what is the clinical settings? The clinical settings, it includes the unopposed estrogen. There is unopposed estrogen. Next is there is the obesity, and there is also the presence of the hypertension as well as the diabetes. Next is the morphology. So under the morphology, it is the endometrioid. So morphology, it includes the endometrioid. Then what is the precursor? The precursor, it is the atypical hyperplasia. Atypical hyperplasia. And then comes the mutated genes or the genetic abnormalities. So mutated genes are the genetic abnormalities. So what does this include? So under the type 1, there includes the P10. Then comes the ARD. ARID. So there is presence of the ARID 1A. So ARID 1A. So what is this? This is a regulatory of the chromatin. Regulator of chromatin. The regulator of the chromatin. Next, what are the things which are included? Next in line, there is the PIK. There's PIK3A. There is a PI3K. Then there is also presence of the KRAS, that is a KRAS, the FGF2, that is a growth factor, and there is the MSI, and the CTN-NB1. So this is nothing but the VNT signaling. VNT signaling. Then comes the presence of the TP53. Now let's look at the behavior. So in terms of the behavior, it is indolent. It is nothing but it is indolent. It is indolent as well as it spreads. So the spread is to the lymphatics. Next we look at T2. T2 refers to the type 2. So what is the age? The age is 65 to 75 years. So age is 65 to 75 years. So how is the clinical settings? The clinical settings is, it includes atrophy and the thin physique. So there is atrophy as well as presence of the thin physique. Thin physique. So how is the morphology? Morphology is in type 2, in type 1 there was endometrioid, in type 2 it is going to be serous. So it is going to be presence of serous, there is a clear cell, there is clear cell, and mixed Mullerian tumor. Mixed Mullerian tumor. Now let's look at the precursors. So under type 2, we look at the precursors. So under precursors, it includes the serous, endometrial, intraepithelial carcinoma. Intraepithelial carcinoma. Next comes the mutated genes or the genetic abnormalities. So this includes the TP53, aneuploidy. There is also the PIK3CA, the FBXW7. So this is nothing but a regulator. So this is a regulator of the MYC as well as the cyclin E. Then there is presence of the CHD4. There is presence of CHD4, that is nothing but it is a regulator of the chromatin. So it is regulator of chromatin. And there is the PPP2R1A that is the PP2A. Next is we look at the behavior. So under behavior in type 2, it is aggressive. It is aggressive. Next is there is intraperitoneal. It is aggressive, it is intraperitoneal, and as well there is a lymphatic spread.